Welcome to the TOEFL Listening section. In this part, you will hear one or more conversations in an academic or campus context, such as a discussion between a student and a professor or between two students. You may take notes while listening. Listen to part of a conversation. You will hear it only once, so listen carefully. After the conversation, you will answer questions about what you heard. Some questions will ask you about main ideas and details. Others will ask about implied meaning, speaker attitude, or how ideas relate to one another. Use both what is stated and what is implied to answer.
Good afternoon, Dr. Malik. Thanks for meeting me during office hours.
Good afternoon, Emma. No problem. You mentioned in your email that you wanted feedback on your paper about the economic implications of the aging population. Where would you like to start?
I want to make sure my argument links demographic change to fiscal sustainability and labor market effects. I have some data on dependency ratios, but I am not confident about the policy analysis.
That is a good focus. The old age dependency ratio is central. As the proportion of people aged 65 and over rises relative to the working age population, governments face rising pension and healthcare obligations and fewer workers to pay taxes.
So would you say the main economic implications are higher public spending and slower GDP growth because of labor shortages?
Yes, but the pathways matter. For example, Japan already has a very high share of elderly citizens, around 28 to 30%, and that has led to constrained growth rates and high public debt linked to pension and long-term care costs.
I read that South Korea is aging very fast, even though it industrialized later. Should I include that as an example of rapid demographic transition?
Absolutely include South Korea as a contrast to Japan. Japan has had a longer period to adjust policies, while South Korea is compressing the transition into a shorter time span, which raises acute fiscal and labor market pressures.
When I write about fiscal stress, I usually talk about pensions and health care. Is that enough, or should I expand to consumption and savings patterns?
Expand. Aging affects consumption baskets, with demand shifting toward healthcare, pharmaceuticals, and age-friendly housing and services. It also influences household savings and investment. Older populations may decumulate assets in retirement, which can affect capital markets and interest rates over time.
That helps. I want to be precise when I discuss labor supply. What policy responses should I analyze, and how do they differ in impact?
There are several categories. First, labor market policies to raise older worker participation, like phased retirement, retraining, and incentives for employers to hire older workers. Second, pension reforms such as increasing retirement ages or shifting from defined benefit schemes to defined contribution systems to improve actuarial sustainability.
You mentioned shifting pension types. Would a move to defined contribution reduce fiscal risk?
Yes, it can reduce the direct fiscal liability for governments because benefits are more clearly tied to contributions. However, that also shifts risk onto individuals and can raise distributional concerns if not paired with social safety nets.
What about immigration and automation? I am not sure whether to present them as central solutions or partial mitigations.
Treat them as partial mitigations. Immigration can help replenish the labor force, but it depends on scale and integration policies. Automation and productivity improvements can offset labor shortages in manufacturing and some services, but they are less effective in personal care sectors where human labor is critical.
So technology cannot solve the need for long-term care?
Not completely. Assistive technologies and robotics can raise efficiency and reduce physical strain, but caregiving often requires human interaction and social support, which technology cannot fully replace at present.
I want to include international policy comparisons. Which countries show promising approaches?
Sweden and some Nordic countries offer useful lessons. They combine active labor market policies, affordable childcare, and flexible retirement arrangements. These measures encourage higher female labor force participation and help sustain fertility levels somewhat while keeping older workers engaged.
Should I discuss incentives for older workers specifically, like tax credits or retraining programs?
Yes, provide examples. For instance, subsidies for employers who hire or retain older employees, targeted vocational retraining, and phased retirement options that allow part-time work and gradual benefit reduction.
I am concerned about the equity angle. If we raise retirement ages to maintain pension solvency, that might hurt blue-collar workers who have physically demanding jobs.
That is a valid concern. A life course approach is important. Policies can include differentiated retirement ages by occupation, credits for caregiving periods, or enhanced disability protections to reduce unfair burdens.
I will add that. Also, I want to discuss long-term care financing. Some countries have social long-term care insurance.
Yes, Germany introduced a long-term care insurance model that shares costs between public insurance and private contributions. That kind of system reduces unpredictable out-of-pocket spending for families, but needs sustainable funding mechanisms as the beneficiary pool grows.
Do you think demographic change will necessarily reduce productivity, or could it increase capital deepening and per-worker productivity?
It depends. A shrinking workforce might lead to more capital per worker, which can raise labor productivity, but the overall impact on GDP is often negative because fewer workers produce less total output. The key policy question is whether productivity growth can outpace the reduction in labor input.
That nuance will be useful. I plan to conclude with policy recommendations that balance fiscal sustainability and social equity.
Good idea. Emphasize a combination of measures. For example, adjust pension parameters like retirement age and benefit formulas. Promote lifelong learning to keep older workers productive. Encourage selective immigration. Invest in preventative health to compress morbidity. And design long-term care financing.
If I include a warning about political consequences, what wording would be appropriate?
You could say something like, if we do not adjust pension schemes and labor policies, the fiscal burden on younger workers will increase and could create intergenerational tension.
That sentence is clear and direct. I will use it and then propose mitigations. Anything else I should add?
Mention the need for data-driven policy. Countries need good cohort-based projections, health expectancy metrics, and evaluation of reform impacts. That will make your recommendations more robust.
Thank you, Dr. Malik. This gives me a much clearer structure and examples for the policy section.
You are welcome. Send me a draft of the revised section and we can refine it further.
I will do that. Thanks again.
Good luck, Emma.
Listen again to part of the conversation, then answer the question.
If we do not adjust pension schemes and labor policies, the fiscal burden on younger workers will increase and could create intergenerational tensions.
This concludes the conversation portion. For more TOEFL practice tests and study materials, visit Spinta.org.